Michael Woodhouse.
Mr Speaker, one of the most important parts of this democratic process is the ability to debate the merits of a policy or a bill, and most of it happens in this House or at Select Committee. That's the pointy edge of democracy, I guess. So while there appears to be unanimous support for this bill, we've heard a number of members on the other side saying that it's tinkering or that it doesn't go far enough, and they want to ask the Minister this and that and the next thing. Well, what I want to know is, if that's of such concern to them, where on earth were they at the part of the bill reading that they could do just that, the Committee of the Whole House? Because while it's very rare to have a public health and disability bill passed unanimously through the House, I'm absolutely certain it's unheard of that it's passed unanimously without a single word or question being asked by the opposition of the executive at the committee stage. So it really does lay bare the empty rhetoric that we've heard, including from the member who's just resumed his seat, over all these concerns about cuts that, frankly, I would be very happy to refute emphatically. Simply empty rhetoric, and none more so than the call from the member, Mr Lees-Galloway, who I would describe as very articulate nonsense. He talks about no strategy for prevention, no true public health prevention strategy, and he even accused national voters and supporters of not having diabetes, heart disease or any other chronic illnesses. It was absolute nonsense. But here's what I would like him to do. I would like him to go to the 75,000 homeowners who have had their houses insulated under the Warm Up New Zealand program, 55% of them who have community services cards, and ask them whether the national government has a public health strategy. When we have 30% increases in the price of tobacco, national government came up with the money. A joint initiative, no doubt, but it never happened under Labor. That's the point that I'm trying to make. What else never happened under Labor was there were never 30% increases in the price of tobacco. Again, unprecedented in this country. And if Mr Lees-Galloway thinks that this government is in the pockets of the tobacco lobby, if he stands as the champion for Labor in tobacco cessation, then he needs to explain why his party, when they were in government, didn't take the same bold steps as a public health initiative. And thanks to the efforts made under this government, nearly 90% of our children are now fully immunised against vaccine-preventable diseases. And thanks to the Health Select Committee's recommendations, which will come out of the inquiry into how to improve childhood immunisation rates, I have every confidence that that rate will go to 95%. Absolutely unprecedented in this country, and again, certainly no public health initiative matched by the previous government. So it's just a fallacy to say that this government is not focused on public health. And I actually suspect Mr Lees-Galloway can't see the wood for the public health trees. Now, there have been some changes. We might have dispensed with a few poster campaigns. We might have stopped funding a particular internet program that didn't actually add any value, because the Minister of Health has made it very clear that our limited resources have to be on services that will add value. And I think there were a few of them that didn't. But it is not true to say we don't fund public health. I think Mr McCulley, actually, in his capacity as Minister of Sport, summed it up. He said when we can spend a lot of money on these poster campaigns or internet campaigns, or we can just give kids a bat and ball and send them out into the playground to exercise. So I think that's what the merits of this government do. Hearing from Ms Dyson nothing from the Minister to reassure the public that their health needs will be met. Well, the extra 25,000 elective surgeries is a good start. The reductions in the cancer treatment waiting times is a good start. The really good performance in emergency department throughput, a really good start. Our immunisation rates, our improvements in our health workforce, the voluntary bonding scheme. I could go on. The very fact is, much as the opposition don't like to admit it, this government has managed to get a lot more for a little more. And I think that's very commendable. I commend the bill.
Members, this debate is concluded. The question is that the motion be agreed to. Those of that opinion will say aye. Aye. Contrary will say no. The ayes have it.
New Zealand Public Health and Disability Amendment Bill, third reading.
Call on Government Order of the Day number 2.